In this video, we're going to talk about how to describe fracture angulation. And there's essentially three ways to do that. All of them deal with two planes. One is the lateral to medial plane, and one is the anterior to posterior plane. Let's take an example of a femur fracture. So here's our femur, a right femur. And say we fracture it here, and it's going to angulate one way or the other. In this case, let's say it's going to angulate this way. Now, how do we describe that? Well, it's the same rules as we talked about before. Pretend you are a human walking from proximal to distal. Now, which way are you turning? Well, in this guy's case, he's going to go laterally. So we're going to describe that as lateral angulation. And the same thing applies if it fractured the other way. Say we fractured here, and it fractured the opposite way. Well, we call this medial angulation. Simple enough. Now, as a shorthand, we've started calling a lateral angulated fracture a special name, and that is valgus. And we called medial angulation varus. It seems to be a more concise way to describe fractures. So another way to say lateral angulation is valgus. And it's easy to remember because valgus and lateral have an L. And if it's angulated medially, we're going to call that varus. And this applies to pretty much any scenario, including your big toe, because hallux valgus, which is a bunion, means your big toe or your hallux is going to be angulated laterally. Let's go to anterior and posterior. Say we have the same bone, a femur, femoral head, and then we have femur. And which way is it going to angulate? Let's say, for this purpose, it's going to angulate this way. Now, how do we describe that angulation? Same thing. If you are walking along this femur from proximal to distal, which way is this angulated? Well, this is anterior. And if the opposite is true, if we are angulated the opposite way, so say it angulates this way, we're going to call that posterior angulation. Simple enough. You can call any fracture in the human body by these two planes. There's also a nickname for this angulation, and instead of saying anterior angulation or posterior angulation, we use the phrases recurvatum and procurvatum. And this is convenient too because procurvatum is another way of saying posterior angulation. So we call this procurvatum, and anterior angulation we call recurvatum. The final way we describe angulation in general is the same final way we do it in displacement and upper extremity fractures. It can be confusing to describe anything in the forearm or distally as medial to lateral, because with the anatomic position, lateral is towards the thumb and medial is towards the pinky. But in human behavior, we can pronate and supinate. It can be a little bit confusing. So to get rid of that confusion on the medial lateral plane, we skip that and just call it in relation to the radius, the ulna. So if fractures toward the radius, we call it radial angulation, and if fractures towards the ulna, we call it ulnar angulation. So let's draw a radius, for example. Let's say it fractures this way. And this is the fracture. And again, what's also convenient is that it doesn't matter if this is your left or a right upper extremity. If it deviates, if it angulates towards the radius, we're going to call this radial angulation. If it angulates the opposite way, so say we have a radius and it fractures the opposite way, it's angulated ulnarly. So we're going to call this ulnar angulation. And finally, in the upper extremity, which way is anterior, which way is posterior. Again, depending on which way you supinate and pronate, it can be confusing. So we just say, forget it. If it goes to the dorsum of the hand, we're going to call it dorsal angulation. If it angulates toward the volar or palmar surface of the hand, we're going to call it volar angulation. So let's draw an example of that. If we have a radius that fractures, and we're going to say this is dorsal and this is volar. Say we have a distal radius fracture, and it'll fracture and angulate this way. And just to help imagine, this is a scaphoid, scarred lunate. The scaphoid looks something like this. The thumb is going to come that way. And then on this side we have a hamate. So the thumb is that way. The dorsum is this way. Which way are we angulated? Well, if you go from proximal to distal, it's going to angulate dorsally. So this is a dorsally displaced distal radius fracture. And if it would fracture the opposite way, so if it fractures and angulates this way, we're going to call that volar displacement. So that's it. That's how you describe angulation in fractures. In the next video, we're going to talk about more complex ways to describe fractures.